All right, everyone, thank you for joining us today. We are going to be talking about the future of healthcare. Now, when I say future of healthcare, I'm not talking about robotic augmentation or microchips, anything like that. I'm talking about a shift in how we view health, a paradigm shift. So today we want to talk about the salutogenic framework of healthcare. So what is salutogenesis, first off? So the word salutogenesis comes from Latin and Greek roots, with genesis meaning the origin or the creation of, and saluto meaning health. And it's the opposite of pathogenesis, which is the origin or development of a disease. So according to Merriam-Webster, salutogenesis is an approach to human health that examines the factors contributing to the promotion and maintenance of physical and mental well-being rather than disease, with a particular emphasis on the coping mechanisms of individuals which help preserve health despite stressful conditions. So, what does this have to do with healthcare? When we look at today's medical model, it largely follows a pathogenic view of health, where practitioners ask the question, what makes people sick? With the salutogenic model, we start to ask what makes people healthy. And so this term salutogenesis was first coined in 1979 by a man named Aaron Antonovsky. So he was an Israeli-American medical sociologist. So he worked a lot with women who had survived concentration camps. And as he did so, he started to wonder, why is it that there are women who have gone through so much pain and suffering and trauma and are able to come out and live such great, healthy lives and even thrive, while there are others who come out and they decline very quickly. So through his work, Antonovsky stated that health is not just a state of being that is without disease, but health is actually something that's dynamic. It's constantly moving along this continuum between total health and total illness. So I have a picture of that continuum here. So on the right, we have health and wellness, which he called ease. And on the left, we have illness and death, which he called dis-ease, literally the lack of ease. So moving towards the left, we have poor bodily function. We have the onset of symptoms that can result in disability, leading to illness and eventually death. While moving to this right side, we have growth and resilience and improvement in higher body function. Now, for Antonovsky, what he wanted to do was, rather than just stopping a shift towards illness, he wanted to identify what is it that promotes health for the benefit of society. So when we look at the mainstream medical system, they do great work on this left end of the continuum, and they save millions of lives. If you have a ruptured spleen, for example, with internal bleeding, you aren't going to be asking what is going to make you a healthier person, because at that moment, what's more important is that you go to the emergency and get that bleeding taken care of. But what I want to make clear is that there's no operation, there's no surgery that can take you from this left end of the continuum to this right side. The same for drugs. There's no drug that can take you from this left end of the continuum and move you to this right end. So when it comes to the promotion of health, the concept of salutogenesis is a much better framework. To move towards health, Antonovsky stated that one needs to have a strong sense of coherence. So what is that? So sense of coherence is made up of three factors: comprehensibility, manageability, and meaningfulness. So where does this come into play, for example, for something like low back pain? If an individual has lower back pain and they see that back pain as a predictable stressor of the body, something that can be explained by a better understanding of their own anatomy, it becomes comprehensive. Now, if they feel that they have the resources that are available to them to meet the needs to help deal with the lower back pain, it's manageable. And finally, if they see their body as something worthy of investment and the back pain as a challenge to overcome rather than a burden, it becomes a meaningful stimulus. So having a high sense of coherence is what has been used to discuss how one can actually maintain their health despite stress in their life, in their body, in their environment. So if we're looking at health in this manner, it then becomes important that we are equipping people with knowledge, with resources to better understand how to be healthy. So right away, the first things that come to mind are things like proper sleep and things like exercise, proper nutrition. All of these, a lot of us know are very important, although it might not be reflected in our day-to-day lives. Now, some other things are people getting adjusted. Is their body in alignment? Are they refraining from things that may be damaging to their body? For example, smoking. We can even move beyond just the physical and talk about the emotional aspect of health, where it becomes very important to have social support and community as part of lifestyle. Now, just to give people an idea of how big, how important lifestyle changes can have on their health, I want to reference a research article from 2020. This was conducted in June 2020. And so it is the effect of intensive lifestyle intervention on body weight and glycemia in early type 2 diabetes. So in this research study, they split participants into two groups, into a lifestyle group where people underwent intensive changes to their diet, to physical activity levels. And then there was a medication group that were given a typical diabetes medication. And these two groups were followed for the span of 12 months. And multiple outcome measures were tracked. And so we can see a couple of them here in this table. So we see weight, waist circumference, fat mass. So these three, there was a greater and larger reduction in the lifestyle group after 12 months compared to the medication group. In terms of the numbers for diabetes, for blood pressure, again, the lifestyle group had much better numbers. Now, interestingly, the quality of life increased for the lifestyle group, but after 12 months, it was lower than the baseline for the medication group. So this is just one example of how important a lifestyle can be to one's health. And the goal of this discussion, this talk, is not to say that the pathogenic model of health is wrong. There are years of work that have been put into that aspect of health. But a heavy focus on pathogenesis has done a disservice to the community, where people are actually very comfortable with a linear model of care, where, for example, you have X, you're treated with Y. So for example, if you have type 2 diabetes, you are treated with metformin or other kinds of diabetes medication. Now, the issue with this is that nothing in nature is linear. The human body is very intricately designed, and so it's complex. It's multifactorial. And so the goal of all of this is to empower you to use Antonovsky's idea of health, that it can be something that's comprehensible, it's manageable and meaningful. And it can be something that can be controlled by you. If you leave health into the hands of others, you end up blaming those around you when things don't go your way. And so realizing the role you play in your own health, especially with lifestyle choice, is key. Now, a discussion with healthcare practitioners that is ongoing is that rather than contributing to a framework of you have X, we're going to treat it with Y, healthcare practitioners, I encourage you to be a health coach for your patients. You have the opportunity to equip and educate patients in the various aspects of health. And so that's something to think about as we look forward to what healthcare could be looking like in the future. And with that, I just want to end off with a quick quote by Aaron Antonovsky. And so right here, he says, "We are coming to understand health not as the absence of disease, but rather as a process by which individuals maintain their sense of coherence, i.e., sense that life is comprehensible, manageable, and meaningful, and the ability to function in the face of changes in themselves and their relationships with their environment." So with that, I just want to say thank you all for listening. This was fun. I'm going to stop the recording right here. So.